The hidden dangers of daily bathing after 70. These 5 habits could be shortening your lifespan. If you're over 65 or have parents or loved ones in that age group, there's something you urgently need to know. A habit most consider essential for hygiene and health may actually be silently harming seniors every single day. Yes, I'm talking about daily bathing. This might sound shocking. After all, we've been taught that cleanliness equals health. But as a doctor with over 40 years of experience treating elderly patients, I've witnessed a different reality, one many refuse to believe. Ignoring it, however, could be deadly. I've personally treated numerous cases where seniors fainted, slipped, or suffered heart complications, all due to their daily bathing routines. Every winter, I see elderly patients collapse in their bathrooms from what they thought was just a simple, harmless bath. So, if you're a senior or care for someone who insists on bathing daily, stay with me. What I'm about to share could save a life, maybe even yours. But before I reveal these critical truths, do me a small favor, like this video and subscribe if you want more life-saving health advice for you and your loved ones. Your support helps keep this vital content going. Now, let's dive into the 5 shocking truths about bathing after 65, facts most people have never heard. Shocking truth 1, hot baths can be dangerous for your heart. Ever wondered what happens inside your body when you soak in hot water? Here's the medical explanation. When an older adult steps into a hot bath, the heat causes rapid dilation of blood vessels, medical term, vasodilation. This leads to a sudden, significant drop in blood pressure. For younger people, this might cause mild dizziness, but for those over 65, especially with high blood pressure, heart disease, or poor circulation, it can be extremely dangerous. I'll never forget one patient, a 90-year-old man who proudly told me, "Doc, I've taken a hot bath every day since I was a teenager. That's why I'm so strong." And he seemed healthy, until one icy January morning when he collapsed from a heart attack in his bathroom. His daughter found him just in time, saving his life. He ended up in the ICU and never bathed alone again. Most people don't realize that after 65, the autonomic nervous system, which regulates heart rate, blood pressure, and temperature, weakens. It can't adapt quickly to sudden changes, like moving from hot water to cold air. The result? Orthostatic hypotension, a dangerous blood pressure drop that can cause fainting, or worse. Here's a startling fact. When someone over 65 bathes in water hotter than 41 degrees Celsius (106 degrees Fahrenheit) for more than 15 minutes, their cardiovascular load increases by 20–30%, equivalent to a light jog. Except, instead of running safely, they're standing in a slippery, enclosed space. Doctor recommended safety tips. Lower the temperature, 38 to 40 degrees Celsius (100 to 104 degrees Fahrenheit), warm, not scalding. Limit time, no more than 10 minutes. Stay hydrated, drink water before and after. Sit down, use a sturdy shower chair. Never bathe alone if over 80, inform someone or use an alert system. These small changes may seem inconvenient, but they could prevent a medical emergency. Shocking truth 2, daily bathing damages elderly skin. We all love feeling clean, but as skin ages, it becomes more fragile. Daily bathing, especially with hot water and soap, accelerates dryness, aging, and even skin damage. Here's why: after 50, your skin produces only half the natural oils it did in your 20s. Hot showers strip away what little protection remains. One of my patients, a 78-year-old woman, suffered severe itching and inflamed skin. When I asked about her routine, she said, "Doctor, I'm just very clean, I scrub head to toe daily." Tests revealed her skin was so dry it had micro tears, leaving her vulnerable to infection. She was heartbroken. Did I do this to myself by trying to stay clean? Unfortunately, yes. Studies show seniors who bathe with soap more than 4 times a week have a 60% higher risk of clinically dry skin. Dry skin isn't just uncomfortable, it's dangerous. Cracks can lead to infections, some severe enough to require hospitalization. Skin-saving bathing methods. 1. Reduce frequency, 3 times a week allows skin to recover. 2. Be selective with soap, only essential areas, armpits, groin, feet. 3. Use pH-balanced cleansers, avoid harsh alkaline soaps. 4. Moisturize within 3 minutes, locks in hydration. 5. Choose ceramide and hyaluronic acid creams, repair and protect. Shocking truth 3. Bathroom falls are devastating, and often preventable. The bathroom, meant for relaxation, becomes a danger zone for seniors. Falls here are the one cause of injury in the elderly, and recovery is brutal. One 88-year-old patient slipped stepping out of the tub, fracturing his hip. Surgery succeeded, but he never regained full mobility, losing his independence. Tragically, 1 in 4 seniors over 80 who suffer hip fractures die within a year. Why this happens? Slippery surfaces, water plus soap equals invisible hazard. Blood pressure drops, standing up too fast causes dizziness. Weakened muscles/balance, age slows reflexes. Prevention tips. Non-slip mats, in tub and on floor. Safety handles, near tub and toilet. Shower chair, reduces fall risk by 90%. Move slowly, let your body adjust. Ask for help, especially if over 80. Shocking truth 4, temperature regulation is critical and overlooked. After 80, the body's ability to regulate temperature declines by 40%. A 92-year-old woman took a warm bath, didn't dry properly, and sat in a chilly room. Within an hour, her temperature plummeted to 34.5 degrees Celsius, 94.1 degrees Fahrenheit, hypothermia. She was rushed to the ER. Post-bath safety steps. 1. Warm the bathroom beforehand. 2. Dry immediately, evaporation cools dangerously. 3. Dress warmly, including drying hair. 4. Drink something warm, stabilizes core temperature. 5. Bathe mid-afternoon, avoid cold mornings/nights. Shocking truth 5, over-cleansing weakens immunity. Your skin hosts beneficial bacteria that defend against infections. But daily scrubbing strips this protective layer, and aging skin recovers much slower. An 83-year-old patient used antibacterial soap daily, thinking it was best. Instead, she suffered recurring infections until we adjusted her routine. Studies show seniors who bathe daily with soap have 35% lower skin immunity than those bathing 2 to 3 times weekly. How to stay clean without harm. Limit baths, 2 to 3 times/week. Avoid antibacterial washes, they kill good bacteria too. Humidify indoor air, 40 to 60% humidity protects skin. Final thoughts. Change is hard, but as the saying goes, the best time to plant a tree was 20 years ago. The second best time is now. Start today. These aren't just hygiene tips, they're steps toward longer, healthier, more independent living. If you found this helpful, subscribe and turn on notifications for more life-enhancing advice. Because with the right knowledge, you can live 10 years younger and 20 years happier. Thank you for watching. Stay safe, stay warm, and take good care of the skin you're in.